Hello, I'm Michael Pierce, and this is The Human Condition. Our topic today is types of fasting. This is an explanation of fasting. I'm going to give you some concepts of different kinds of fasting and some of the methods to watch out for. Certainly fasting is a great way to take care of your health, and it has some dangers, and I'll explain those to you. Please go to our website, humanconditionlab.com, send us your email and get my free ebooks, as well as joining our membership list so you can be part of our events and our special live events where we come together and talk together and do questions and answers and ask me anythings. Types of fasting. There are a number of types of fasting that have been listed from biblical days all the way until now, and they can be very beneficial. There are a few little dangers, but I'll go through those, and I think it's important to realize that fasting can be a very good tool for individuals to use. If a person is generally healthy and they want to try a fast, it turns out that the thing called autophagy, which is self-digestion, really begins somewhere after about 2 days of fasting. So you have to get through the first 2 days, which is usually the worst, and then you feel better, to get the benefits of autophagy. So because people sometimes have the dangers of refeeding injury, which can be very, very dangerous and can kill you if you don't refeed properly after a fast, if it's long enough, you want to make sure that you understand that sometimes people need medical management. Now, a lot of people will do intermittent fasting. They'll fast for about 16 hours between meals, and there's several different kinds of intermittent fasting that rotate throughout the hours of the day. But generally, people just eat an early dinner, go to bed, don't eat any more food until the next day lunch. They just skip breakfast, and that gives them about 16 hours between meals. That can be highly beneficial at retuning the blood sugar and the insulin response in people, as well as what's called the glucose tolerance. However, there are added benefits to fasting longer than 16 hours. Some people don't do very well, especially hypoglycemics. If you're very hypoglycemic, you might have trouble with fasting, and you might need to talk to a doctor and do other things like mineral repletion and protein repletion and vitamin repletion. There are also people that are on medications and they can't do fasting because of their medications. The fasting that I'm speaking of is usually water-only fasting, although there are places and people that do mineral and supplement-based fasting where they don't eat any food, but they take some vitamins or they take some minerals or they take some salt with their water. There's big debates going on about this, but you can make your own decisions about these things. I think that for water fasting, our topic today is that if you don't have any contraindications, heart conditions, brain concussions, problems with medication, especially if you're diabetic, you might do very well with the fast. You want to talk to your doctor and you want it to be medically managed. It would be nice if someone could monitor your vitals, your temperature and your blood pressure and your pulse and your respirations, and it'd be nice if they could take your blood and look at your electrolytes and your blood signs once or twice a day. So medical management of a fast that's more than, 4 or 5 days is pretty reasonable. I think most people that are medically healthy enough can do a 2 to 4 day fast and be okay. Generally, the first 2 days will be quite difficult because people are retooling their metabolism and they're changing their insulin response. They can get very headachy, they can get nauseous, they can get super hungry, they can get irritable and cranky, they can experience low blood sugar events, they can feel not so good as their body switches into what's called ketosis. And believe it or not, yes, when you're fasting, you're in ketosis. At some point, you switch into ketosis and your body starts to burn ketones. And some people can take days for that to really kick in, and that's usually those first 2 days. Making sure that a person has enough minerals, sodium and salt and other types of minerals like chromium and vanadium and magnesium and zinc and copper and molybdenum and manganese, all of these are extremely important for a person to make sure that they do ahead of time before they go into a fast, if they can possibly do it. So this thing I talked about called autophagy is self-digestion. It's where your body's cells intelligently decide which cells they're going to sacrifice and they're going to digest. So they will decide that some cells are ready to go, they will digest them. Some of the cells are already dead and there's just debris hanging around, and the body will find that debris and clean it up. It's a lot like sweeping a dirty floor. You collect all that debris and ultimately you digest it. It has to go through your lymphatic system. It's very possible for a person to need to do things like skin brushing or even ice baths at times, and you've got to talk to your provider to figure out if you can do those things, because some people can't do an ice bath or do any phenomena like that while they are fasting. Most people are advised that if they're going to do a fast, that they should be very quiet, that they shouldn't try to be doing very high mental tasks or physical tasks. Certainly you're not going to be, plowing your driveway or trying to garden when you're fasting. That's probably not the best idea. We don't want you necessarily out in the sun sweating and losing a lot of electrolytes over the course of the day. We want you to largely rest and be indoors and not be in the sun and not be exerting yourself either mentally or physically while you're doing a fast. As I said, I think that over about 4 days, people that aren't trained probably would be best with medical supervision for their fasting if they're going to do 5 days a week, 2 weeks, 3 weeks, 4 weeks, up to 30 or 40 days. I'm a big fan of the True Health Clinic with my friend Alan Goldhammer up in Northern California. I think that's a place where you can go to actually do fasting retreats, and I think you should consider looking into that if you've never done it before, where you can do medically managed water-only fasts. That group is doing some of the best work in the world on blood pressure and cancers and water-only fasting. And so they can help qualify you and figure out if you're qualified for one of these fasts. And if you're a healthcare practitioner, you can actually go and study and become an intern. And so it's very important to understand that. I've been part of fasting programs for many, many years, and I think it's important to talk about the refeeding injury, because after a person breaks their fast and they end their fast, they need to very, very slowly add food back in. It's important that they not add too many calories over the first few days of eating after an extended fast. If a person goes on an extended fast and they eat too much too rapidly, they can have organ failure and they can die. So it's really important to not refeed without knowing what you're doing. And so I think you'll find that kind of work is well described up at True Health and at other places where they medically manage fasting. So please, if you're interested in fasting and you want to control diabetes, you want to work with your prescriber, your doctor, to understand your medication and tweak your medication as you try to control your insulin resistance and your type 2 diabetes, or even to some degree type 1 diabetes, it would be very useful to try to consider that. Fasting is used by people to try to help with cancer and autophagy. It's used in diabetes. It's used in the reversal of many chronic diseases. It's used in arthritis and pain. It's used in healing from stroke, and it's used in healing from brain injury. Fasting is used in weight loss. It's used for a number of different conditions, and it can be used for spinal injuries and chronic pain. It's used for sleep disorders. Fasting can be a very, very important part of your life, and I think it's important to hear about it and talk about it because it's largely free and it's largely safe as long as you pay attention and you work with people in your life to do it right.